Hey Psych 250 students, this is Chapter 8, Volume 2. Only 2 videos to watch for this particular chapter. And it's dealing with a pretty serious topic, and that would be suicide. We left off about talking about a case study that I want to share with you. So if you have any kids around who happen to be watching, you may want to watch this first before you let them watch it to determine if this is good information for them to hear. And that goes for the whole chapter, actually. When we talked about intention, suicidal thoughts, one of the things where it's been handled in movies in a very positive way is a movie called It's a Wonderful Life. Now, this is usually shown around Christmas time, but it's one of my favorite movies of all times because it's about a fella who really has some bad things happen to him, and he starts to contemplate, maybe I'm worth more dead than alive to help my family. Maybe it's not worth being around anymore. And the story involves a guardian angel trying to earn his wings and trying to get him to see what life would be like if he didn't exist at all, which is pretty interesting. How many people's lives we've changed without even realizing it. Excuse me. So let's get to our story. The name of the story is called Papa in the Garage. It takes place when I worked in private practice. And the private practice was in Lansing, Michigan. Usually in private practice, you decide how many hours you want to work, how many clients you want to see. Sometimes you can set limits as to what clients, age-wise, issue-wise, you're willing to see. Typically what happens when you're set up to work a few nights out of the week, and I was working there part-time, I would get there a little early. So with the client, they'd fill out the paperwork indicating what their issues were. In this case, it was a mother and her daughter. Her daughter was approximately 8 years old. And the daughter and mother had come in primarily because of being very stressed, being very depressive, and for the others, lack of sleep, lack of concentration, that sort of thing. And for the other section, they wrote in suicide of father. Now, in cases like this, it's a pretty serious issue. It's not like divorce, and that, which is pretty serious too, but they still have both their parents, right? Here, I had to be very careful. I wanted to interview them collectively first, and then take turns talking briefly with mom, separate from daughter. With daughter, of course, it wouldn't be like this typical stereotypic therapy session where you're sitting across from the person and asking them how they feel. More involved playing with toys, drawing things, and then trying to get them to open up and process why they were there, why their mother brought them there. The story goes as following. Mom was cooking up a storm. She asked her 8-year-old daughter to go and get her dad in the garage. Dad was always tinkering with stuff in the garage after he was done with work and before dinner started, right? Working on projects and so forth. So that's pretty normal. Daughter runs to go get dad to tell him that dinner is ready. Mother hears a scream. She immediately drops what she's doing, runs to the garage, and she sees her daughter looking horrified. And she becomes horrified when she sees the father hanging from the rafters of the garage. A horrible sight that they couldn't get out of their minds even if they wanted to. The police are called, the ambulance is called, they take the father down. He's dead on arrival. There's nothing they can do. Suicide. With my therapy session with mom, it was kind of the things that you would anticipate. A lot of mixed feelings. Of course, incredible grief, incredible sadness, some anger. How could you do this? How could you do that to us so that we would both see this? I'm sure the father didn't really even process who was going to find him, right? What did I miss as a spouse? If I had been a better spouse, maybe that would have made a difference. If I had listened, if I had seen all the signs a lot of self-guilt. Right? With the daughter, very similar reaction, right? Not quite understanding why her dad would leave her. If she would have been a better daughter, maybe if she had picked up her toys faster, maybe if she had brushed her teeth better, maybe if she had done better in school, her dad would have killed himself. And it's such a tragic thing to hear both mother and daughter take on all this self-guilt, this notion that if they had done things differently, they could have made a difference. And again, we go back to that notion I mentioned in the first video. No matter what you do, if a person's bound and determined to end their lives, they probably will be successful, right? We can only look for signs, we can only anticipate, but we have our limitations. Most of us are not mind readers. Most of us cannot tell how a person's feeling. Sometimes we ask people that we suspect how they're feeling, and they say, fine, fine, fine. And they, in fact, could be suicidal. So people aren't always sharing things, how they feel. But I do tell you that if you have somebody who says that they're thinking about killing themselves, and they tell you, don't tell anybody, it's a secret. Now, you promise to keep their secret. And I value secrets, and I value promises. But if it's anybody who tells me not to tell somebody they're going to harm themselves, I would break that promise. Now, that person might hate your guts because you involved other people. But later, they may come and thank you for saving their lives because they were going to harm somebody or harm themselves. And you put an end to that. They may never forgive you. They may say, I hate you for the rest of your life. I'd rather live with that than knowing I knew they were going to harm themselves and not do anything about it. Your occupation could have a role into whether you're more likely to commit suicide. Now, you would think that physicians, especially psychiatrists, would have their stuff together. Lawyers, law enforcement, dentists. What do they have in common, these professions? A lot of stress, a lot of hearing of people's problems. Now, it doesn't mean you go into the helping professions, you're doom and gloom because you hear all the anxiety and depression, that's going to be your life, right? That's why self-care is important in the helping professions. You got to maintain good self-care. Take good care of yourself. Right now, this is good advice for everybody who's kind of stuck in their houses, not able to go to the stores they want to go, not able to do the activities they love to do. They have to find some things to occupy their time besides chapter notes and exams and papers and so forth, and other things that you actually enjoy, right? Dentists. Most people don't want to go see a dentist. You remember my story of the sensitive dentist, right? So he found a way around that, not just to help his patients, but also maybe a little self-care himself. As I mentioned, guilt, huge issue when it comes to people that are survivors. Why did that person self-destruct? Why wasn't it me? Why did they leave? And one of the things I processed with mom and daughter was their emotions. First, you should never apologize for emotions, but their emotions were very normal, very predictable, things that they should have been experiencing. So to feel anger towards a person that's at the same time you're feeling loss, very normal, very normal. It can have pretty lasting effects. Kids that grow up with a parent that's ended their lives may wonder, I wasn't worth staying alive for? Now, obviously, that thinking has to change. Obviously, adults' worlds are very different from children's worlds. But they'll have to process that. And a lot of us don't process things. We stick them in the drawers. We don't want to process them, right? Well, only adults commit suicide, and we know that's not true. Children and adolescents sometimes are overwhelmed, and you might think, what on earth could they be overwhelmed with? They're just kids, right? Well, we know that in our cultures, the Hispanic Latino culture, the Latinx culture, the American Indians, Alaska Native females are more prominent when it comes to suicide attempts. And why? Well, I think you can ask yourself that society plays a huge role in that, what the expectations are, how we treat one another, how we treat females. the injustices in society. So what are we really struggling with as children and adolescents? We want some issue of control in our lives, which sometimes we don't have any control because we're kids or we're adolescents. We want to retaliate against somebody. We want to get with a loved one who might have been departed. We want the pain to stop. And of course, one of the dangers is if you're under the use of substances, then your thinking isn't quite right, right? And we might hear about other young people killing themselves. And we think, hey, they did it. Why don't I? Right? Known as copycats. Bullying is pretty prevalent. We've had many initiatives to try to end bullying. And yet we see it pretty rampant online, which is a whole different world than the one I grew up with. When I was a kid, if we had a bully that was picking on a particular person, you just had to try to avoid that bully on the way to school, on the way home, or at school. Now, the bullying can occur from strangers online, from all corners of the world, which is quite ironic and sad. So, let me talk a little bit about treatment. One of the issues of treatment is to have a prevention contract. As a therapist, you're working with a lot of people, and sometimes people say, you know what, I just feel like I don't belong in this world. I'd like to just end my existence in this world. So you have to come up with what's known as a no-harm contract or a prevention contract, in which you get the person to agree that they will not harm themselves. Now keep in mind, people can lie right to your face, look you right in the eye, sign anything you want, and still do what they have to do. But your job is to document with their signature that they have agreed not to harm themselves, and that if they get any inclination to harm themselves, they will go immediately and to an emergency room or contact the police or somebody who can immediately give them help. This is documentation to protect yourself, but also to try to protect the client. If you feel that the client is not willing to sign that and you feel that they may be a danger to themselves, then this is one of the exceptions where you have to break confidentiality. Everything they say is confidential with a few exceptions, of course, and one of them is self-harm, suicide. Psychotherapy can be very effective in working with suicidal patients because we're treating a variety of different issues, mainly depression, feelings of hopelessness, feelings of loss, whatever the case might be. Sometimes medications might be a good treatment for some of the symptoms, but processing, getting people to recognize that they in fact do have control of their lives and that things will get better. And I'm an optimist, so I'm always saying that. Things will get better. I'm absolutely convinced that we're going to see each other soon, hopefully, in person. But I'm a realist too. So this is the best we can do for now. Now for the final review for this exam. Here's a few questions. Of course, I'm going to ask you a question on Papa in the Garage case study. I want you to describe the case study and go over treatment issues. For Chapter 9, I want you to talk about the differences between men and women when it comes to suicide issues. And for number 10, I want you to talk about prevention contracts. Why do we need them? What purpose do they serve? Right? These are things that you could find obviously from Volume 1 and Volume 2 of these videos. I appreciate your attention. I hope that you stay safe. The exam will be posted around March 26th, and you'll have approximately a week to complete it. Again, my advice is to fill out those answers, get them back to me as fast as possible. Don't wait till the last minute, because then you may not go through, you may not have well thought out answers. Get it done. And since we're spending so much time in the household this time, it's not like we have nothing to do, right? Best of luck. Go for a walk. Social distancing. Be healthy. And be happy. Thank you.